Hi, everyone. Thanks for spending some time with us this afternoon. My name is Rhonda Dearborn again. I'm the editor for counseling at Springer Publishing Company. We are doing a webinar today, Transitioning to Telemental Health During a Pandemic, 5 Things Every Counselor Needs to Know. We're so lucky to have our presenter, Dr. Heather Robertson, with us. Just a couple of notes about today. This event is being recorded. It will be disseminated in 5 to 7 business days via email. So you'd be able to share it with colleagues, and those of folks who registered but could not join will be able to receive it. You will also get the PowerPoint presentation, the deck that Dr. Robertson does today, in a PDF. So that will be going out as well. If you have any questions, we will be doing a question and answer session at the conclusion of Dr. Robertson's presentation. If you have any questions, please put them in the QA box at the bottom of your screen, not the chat box, but the QA box. So please put your questions there, and we will have some time designated at the conclusion of Dr. Robertson's presentation. We will be doing Q&A, so put your question in the Q&A box. And I'd like to now introduce Heather Robertson. Just a little bit of background on her. She is an associate professor of counselor education at St. John's University. She's a licensed professional counselor, a licensed mental health counselor, a nationally certified counselor, a certified rehabilitation counselor, a credentialed alcoholism and substance abuse counselor, an approved clinical supervisor, a global career development facilitator, and a board-certified telemental health provider. She earned her PhD in counselor education and supervision from Virginia Tech, her master's in counseling and guidance from Texas A&M at Corpus Christi, and her bachelor's degree in policy studies from Syracuse University. Dr. Robertson has served as the president of the American Counseling Association of New York and the New York State Career Development Association. Her research on the preparation of professional counselors engaging in distance counseling has resulted in research grants awarded in 2018 and 2020. She has presented at national and regional conferences on telemental health and is the author of our new book from Springer Publishing Company, Telemental Health and Distance Counseling, A Counselor's Guide to Decisions, Resources, and Practice. And with that, I'm going to turn it over to you, Heather.
Thank you, Rhonda. Thank you for that introduction. And also thanks Springer Publishing for the opportunity to be here today. And also thank everyone who's tuned in, decided to spend some time with us this afternoon to talk a little bit about telemental health. Thank you all for being here today. So I'm going to start out today just briefly talking about, common language and the relevance of telemental health. And I want to spend the bulk of my time talking about these 5 areas with you. We'll spend our time talking about ethics and relationships, equity and access issues, technology, and of course, funding and reimbursement for telemental health. I certainly don't have time to cover everything regarding telemental health today. Obviously, a lot of the details are in the book, but we'll give you some broad brushstrokes, and we'll talk about other issues briefly you might want to pay attention to if you are working in telemental health, and then we will have some time later on to have some questions and answers discussed at the program. So thank you again for being here and joining us. So we're actually going to start out with a poll question. And if you're at home, if you wouldn't mind thinking for a minute about before COVID. So for us here in New York, the onset of COVID was sort of March and April of 2020, but wherever you are, that might be different. But before COVID, tell me a little bit about how much telemental health you provided, how much distance counseling you provided to your clients and students. I'm aware you might have school counselors and mental health counselors, but did you provide telemental health to all of your clients and students before COVID? About 3/4, about half of them, maybe a quarter or less of them you provided telemental health to, or maybe you just weren't doing any telemental health before COVID happened, or maybe you just weren't practicing, and that's okay too. But go ahead and click on one of those options for us and let us know before COVID, whenever that hit for you, before that time was, how much telemental health were you doing? Okay, so before telemental health, really folks were not doing any. Probably the majority were not doing any telemental health. Some were really just not practicing, or even if you were doing it, you were doing it maybe less than a quarter of the time. Some of you, about 3%, which is great. We're seeing all of your clients via distance counseling and telemental health. So they really had this foundation prior to. All right, so let's close that survey and go on to where you are now. Let's talk about right now where you are in your practice. Currently, how much distance counseling and telemental health are you providing? So again, Are you seeing all of your clients and students via distance counseling and telemental health? About three quarters, about half, maybe about a quarter or less. Maybe you're still doing face to face, you're not doing any distance counseling, or maybe you're not practicing, and that's okay too. Just let us know sort of what you're doing now. How has your situation changed now that we're in the COVID-19 era? I always say post COVID-19, but it's still going on. So now that we're in the midst of a COVID-19 crisis, what are you doing currently? And we'll give folks a few minutes to answer those, and then we'll see how has it changed? How has it changed for our audience? Yeah. Okay. So big change. We went from 3% doing all of them to 54% seeing all of their clients post, via telemental health. And again, it's a big change. And there's very few maybe who weren't doing it at all. Now we have 3% who are not doing it at all. So we had a complete turnaround there as far as doing 100% and or doing not at all. And thank you for that slide and for participating in that. And that's really what brings me here today to talk to you, is to say this is what happened. And we'll talk about that and how that happened and how the change came about. Is suddenly with the COVID crisis, we all sort of had no choice. And let's dive into that a little bit. Before I start with that, I want to just give you some common language. I'm not going to read these definitions to you. I have a definition for you for distance counseling, a definition for telemental health, but you'll notice they all talk about using technologies, using communication technology. And so when we're talking about distance counseling and telemental health, we're talking about using technology to provide counseling services. Now, the preferred term, probably the most common term out there you hear, is telemental health. But I did cite a study for you where, a couple of researchers found over 19 different terms out there used to provide telemental health or describe telemental health and distance counseling. So that's something to keep in mind. I'm going to use the term telemental health today, and I'm going to use the term distance counseling. And a lot of times folks ask me, Heather, why do you use both? Why do you always say distance counseling and telemental health counseling? And there's a few reasons for that. One being that I know that everyone now is doing distance counseling. They were doing it before COVID, but now almost everyone is doing it. And that includes school counselors and rehab counselors and career counselors and people for whom prior to COVID-19 maybe didn't consider telemental health, or at least mental health, part of their scope of practice, but they're still engaging in distance practices. So sometimes if we just use the term mental health, for example, in the school counselor realm, they do a lot of personal social, but as soon as we put a mental health title on it, it has to be referred to a social worker or a psychologist. Or in the rehab world here in New York, we can't use rehabilitation counseling to meet mental health licensure requirements. So we have to be careful we don't exclude certain groups. All professional counselors, social workers, psychologists, or the vast majority are doing some sort of distance delivery. And that's why you'll hear me use those two terms today. Other terms that you may hear me talk about are different platforms, right? So you might hear the term synchronous or asynchronous platforms, meaning synchronous in live time or asynchronous, kind of a store and go messaging chat feature. You also might hear blended platforms. So a lot of us nowadays use Microsoft Teams. It's a good example of a blended platform. You can video conference on that, you can phone call, or you could send messages on Teams. That's a blended platform. You also might hear me use the term turnkey, and probably I use the examples of two of the biggest turnkey programs out there are BetterHelp and Talkspace. And those are programs that are built and designed sort of for the clinician to walk in, and the platform has been set up for you to, take clients, take notes, various modalities there, whether it's video or phone or chat. And that's sort of built and designed around the whole system is sort of set up for you. We'll also talk about modalities. So I'll mostly talk today about telephone, video, email, text, and chat, but there are other modalities, things like gaming and podcasting and mobile apps and ICBT. A good example of ICBT is any of my college people who are familiar with Alcohol EDU. That's an interactive CBT program. So we won't talk too much about them, but they are growing and emerging. And, there's limited direct client to counselor interaction in those programs, in those technologies, but they are being used to supplement counseling. So we won't spend too much time there today, but it is a modality that could be considered in the future, or that's actually being used now. I'll also use the term setting. So what type of setting are you in? Is it an intentional setting or an unintentional setting? And by intentional, what I'll say is that right now, post-COVID, most of us are doing intentional distance counseling. We've set it up with our clients that way. With our students, we're using Zoom or WebEx or VC or DoxyMe. Whatever you're using, you're setting it up to deliver services that way. But before COVID, a lot of us may have unintentionally provided distance services. So you have a client or a student who's in crisis and you get in the phone and have a telephone session, or you have a client or a student who's out of state and you want to provide a distance session with them. So as we think about our ethics, we have to think about the setting in which we're providing services. And there's a bunch of other terms that I'll use today If you feel like there's a term I use that's not clear, just go ahead and put it in the Q&A box, as Rhonda mentioned, and I'll do my best to clarify that for you once we finish to the Q&A section. So I'll talk briefly about the relevance of distance counseling and telemental health because some of you might not like it. There are still some people out there who are like, I don't like it. I don't want to do it. It's not for me. And that's okay. It might not be for you. But I want to say it's not new. It's been around for a long time. Psychiatry back to the 50s and 60s has been using web-based, excuse me, not web-based, but closed circuit televisions, NASA to check on mental health and physical health of astronauts from a distance. Telephone counseling has been around since the 50s and the 70s. So it's not a new modality. But here's what's happened. In the past 10, 15 years, the technology has gotten better and more accessible and cheaper. Let's be honest, right? Every laptop now has almost every laptop has a webcam built in. It has an audio technology and microphone built in. More people have smartphones nowadays. So what's happened is with this increased access, the popularity and utility has grown, even before COVID, right? But then what happened is COVID hit, and everyone had to move to distance counseling or telemental health. And as a professor, a lot of my students said to me, Dr. Robertson, I don't like this. I don't want to do this. This isn't why I signed up to be a counselor. And as a professor, I understand that. I empathize with that. But at that time, that's all we had. There's no other options. At least there wasn't last March and April, May, and June. For the rest, you can understand that. So, even if you didn't want to, some people were forced into using telemental health. And then, I'm not going to read this to you, but if you're familiar with telemental health at all, you may have seen that Health and Human Services came out in March and said, so, we're not going to impose any penalties for HIPAA violations as long as the practitioner is operating in a good faith telemental health session, right? So they're saying, well, as long as you're trying to do the right thing, we're not going to impose HIPAA violation rules against you. And that was really unprecedented. When that came out, we were like, whoa. And some clinicians kind of saw that as like an open door, an open gate to practice. But there's risks with telemental health counseling, and that's what I want to kind of talk about today as well. If you don't like it, I encourage you to look at the research. You don't have to believe in it if you don't want to, but the research shows it's effective, right? The research shows that not necessarily it's better than face-to-face, but that it's as effective or certainly more effective than no treatment at all in a lot of cases. So there's a lot of studies. Just the last 5-10 years, you can look back and you can see across the fields, it's been pretty well supported by the research. And there's a lot of benefits to, specific populations and general populations. It's done a lot to reduce to get access to rural populations or those who have limited mobility or those who might not seek treatment. The rub, though, is that not all populations have access to technology, and we'll talk about that under access. Just because it works doesn't mean everyone can get to it. I also talk a lot in the book, but not too much today, about the training dilemma. Training programs are very inconsistent, so they vary in cost and they vary in content, and they're not necessarily required. And what's considered good training versus bad training? So the clinician is kind of left to say, how do I know when I'm competent, right? And that's where, like I said before, there are credentials available, but they're not necessarily available in all specializations. So a lot of the credentialing that's out there is tied to mental health, which leaves our school counselors where? Well, how do I know if I'm doing this effectively, right? And of course, they vary. Also, if you are a licensed or certified provider, your state licensing boards may have requirements for training. There was a period of time a colleague told me that Arkansas was requiring a certificate to deliver distance services, but that seems to have gone by the wayside in the wake of COVID. So we'll talk later on about your own state and what you need to know in your state. So my point today is going to be that there's pros and cons to telemental health counseling and distance counseling, and you have to spend a little bit of time assessing your practice. So let's dive right into it if we can. So I didn't put these 5 topics necessarily in any order, but I did start with ethics by design, because I think that all helping professions, whether you're a counselor, a social worker, a psychologist, need to start with the ethics of the profession. And you'll see under every heading, I have a little subheading, and that subheading is what I want you to sort of take away from today. So what I want you to take away under ethics is both legal and ethical guidelines. So let's talk for a minute about legal guidelines. I think when we think about legal, everyone says, oh, HIPAA and FERPA, HIPAA and FERPA. And that's true. HIPAA and FERPA, EPHI, electronic health information, it's all important. But what does your state say about distance counseling and telemental health delivery? And that's what I want you to think about. If you don't know, take a look at your state requirements. Take a look at your state scope of practice. Have they come out recently and said anything about distance counseling delivery? What I think you'll probably find is that a lot of states opened up their requirements after the wake of COVID. Right? So I'll use New York again. New York was like, yeah, okay, you can deliver distance services, but the supervision has to be face to face. And in New York, we're like, how are we going to do that? We're all on lockdown and shutdown. I mean, that's since changed, but you have to really spend time looking at your state laws. New York did eventually change that, by the way. But at the same time, if we weren't paying attention to what was happening, what the state was putting out from a delivery standpoint, we wouldn't necessarily know whether or not we're in compliance. So I want to say, don't just think about federal laws. Of course, think about those too, HIPAA and FERPA, but also think about your state laws and what's happening in your state. There are some great resources out there. Again, I talk about them in the book where you can sort of drill deep into whatever your specialization is, whatever the state law is for that. There's a great app out there for that. Um, let's talk about ethical codes because, of course, we all say, yes, follow the codes, follow the codes, follow the ethical codes. But really, your codes are very specific to your counselor identity. So I have a lot of different specializations. Right now, I work primarily in voc rehab and career development. But 2 years ago, I worked primarily in mental health and substance use. So I have a lot of credentialing that ties to what I'm doing at that moment in time. So what you need to pay attention to is what is your population and what ethical codes are you bound to in your practice? Because what you'll find, friends, is that there are variations. The example I use a lot is the American Counseling Association and social media. So if you look at the section on delivering distance services under the ACA codes, they're very explicit about social media relationships being prohibited with clients. However, if you look at the National Career Development Association, which is the Career Counselor Code of Ethics, that requirement is not there. It just says you have to have a consistent policy for social media when it comes to connections with clients. So you need to really pay attention to not just your profession, your laws, and your guidelines. What do your ethical codes say in response to your practice modality, in response to your specialization? I want to say too, like a lot of times, this was even before COVID, probably who has the most detail and ethical codes regarding technology is school counselors, which is funny. We think that they're probably doing it the least before COVID. They have the most guidelines out there regarding technology and, civic responsibility regarding technology. So there's a lot of guidelines within their ethical codes in ASCA. Um, so while I don't have time to dive into all the codes, and in the book we do break down the ethical codes for each of the specializations, I do want to talk about a few things that you're going to find no matter what ethical code you look at. And the first is counselor competence. So you need to be competent to deliver distance services. All the codes talk about being trained and being competent. What they fail to do is define what makes someone competent. And that's part of that training dilemma we'll talk about, or I talk about more in the book, is that, it's hard to determine what competence equals to. Also technology. We have a whole slide in technology, so I won't spend too much time here, but all the ethical codes mentioned, we have to use good technology. We have to have proper technology that's secured and encrypted and that follows all of the guidelines that are set out by whatever area of practice we're working in. So we'll talk about technology a few slides from now. Also, all the codes talk about client confidentiality and client identity. So if you have not considered this before, when you're doing email counseling or chat counseling or text counseling, how do you know the person on the other end of that device is who they say they are? If I'm meeting someone for the first time via video conferencing and they're across from me on the screen, how do the person that's across from me is the person they say they are? So again, in the book, we talk about how you can address some of these things, but you also have to keep that in mind that all the codes say that's part of your responsibility. Does the client have a confidential space in which they can work with you? All the codes also talk about screening. So it's your responsibility. We talk about this again under access, but all the codes, I'm sorry, talk about, is your client appropriate for distance counseling? Is your student appropriate for distance counseling? Now, what do we mean by appropriate? Well, do they have the developmental abilities to engage in telemental health? Do they have the technical abilities to engage in mental health? If they're a minor, do they have parental permissions? Do they have the technological skills? Do they have access to the technology? So we talk about this again under access, but all the codes are very clear that it's the counselor's responsibility to engage in client screening. And the last thing that I'll mention under this slide is your informed consent and your emergency planning. There's far too much detail for me to cover here, but you cannot use the same informed consent for distance counseling that you delivered for face-to-face services. Your consent forms must be different. And the information you should be including in those forms, again, I've detailed that in the book for you. I've pulled it right from the ethical codes. So in the ethical codes, you can see what is expected of you to be included in those informed consent documents. And that also includes emergency planning. So emergency planning is a big risk in distance counseling. We all know that. If I'm working with a client, or a student across a screen or across a keyboard or across a phone, and that person is in crisis, how do I execute an emergency plan? Which is very different than the person is sitting in front of me. So again, we talk more about this in the book, but you need to make sure that your informed consent and your emergency documents, meaning the forms you provide upfront before you deliver services, are specific to distance counseling and telemental health. And here's where I just want to say the concept of intentional or unintentional services comes into play, because someone might say, well, I'm just delivering face-to-face services. Even if you're just delivering face-to-face services, you should still have a small clause in there about unintentional distance services, because the rules are different. That would, if the person contacts you in crisis, are you going to hang up and say, I'm not going to talk to you? Well, maybe that's one option. But maybe if you have a clause in there with some expectations, you'll have some guidelines to follow should that happen in the case of unintentional distance counseling. All right, lots of information there. Let's talk a little bit about building relationships in distance counseling. So again, I'll talk about my takeaway for you is trust and rapport from a distance. How do you build trust and rapport from a distance? And so, as we know, it's different from face-to-face services, right? We know that if I had a client face-to-face and I asked you how you build trust and rapport with your face-to-face clients and students, you'd tell me things like, eye contact, body language, smiling, attending, listening, being non-judgmental, all of those things that you learned in your master's programs to build trust and rapport, you would do. But when we move to a distance modality, that changes, right? So we will talk later on about things like eye contact and body language, how we lose some of those things. If I'm using a video conferencing platform, I have some of those things I had face to face. I have, eye contact, even though it's skewed slightly on a computer. I might be able to read body language, but I might not be able to assess subtleties. So for example, I worked for a long time in substance use, and maybe when I was sitting across from somebody, I could sense things, I could sense odors, I can sense emotions that perhaps are harder to assess across a technological field. On the phone, it's going to be even more difficult. I have to build in intentional strategies to assess relationship, and you have to talk about them. You have to tell your clients and students, it's a little bit harder for me to get to know you across a screen or across a phone or across a keyboard. Here are some things I might do to help me understand how you're feeling, or here are some things I might say. And I talk about some examples in the book where I say things like, you might say to someone across the phone, if I was sitting across from you, what would your body language look like to me right now? Because you're missing that, right? And you're also then making your student or client more aware of their body language and what they're expressing. Things like eye contact, like I mentioned before. Regarding video image, for me personally, when I practice in distance counseling, I like to put my hands somewhere where the client can see them on the screen. So either I'll kind of fold them across my lap, or I'll fold them kind of on the arms of my chair, because as we all know, telemental health is a lot of distractions, right? So someone could be right now, you could be listening to me. I'm sure you are. I take no offense if you are. If you're listening to me and multitasking, looking at your email, looking at an agenda, but we would never do those things for a client or student who's sitting across from us face to face. So for me, I want my clients and students to see my hands. I want them to see them in my lap, or if I'm taking notes, see my notepad in my hands, because I want them to know you have my full attention. I'm not doing multiple things while I'm focusing on you and trying to have you trust me. Things like silence is really tricky in distance counseling, right? So again, when I'm silent, am I silent, or has the screen frozen, or has the call dropped off, right? So you want to explain these things. You want to talk about them and say things like, hey, it's hard to tell when it's silent, or I don't want to cut you off if you're not done speaking. So maybe when you're done, let me know that you're done. So you kind of use some subtle cues to build those relationships. You can also use assistive tools. The beauty of Zoom and WebEx and things like that is you can share a screen. So you can share a feelings chart. You can share an emotions wheel. If you're using, email or text, you can use emojis if the client knows how to use those things. So you also have some tools to help you portray emotion as well. But the key is that you have to discuss with your client the ways in which it would be most helpful to them to build that trust and rapport from a distance, and talk about how the technology makes it different. All right, let's talk about equity and access. And my takeaway for you here really is the importance of you assessing your clients and students in whatever context they're in. Okay, and we talked about this briefly under access issues earlier. But we know that telemental health and distance counseling has a lot of benefits to a lot of different populations, right? So specifically, clinical differences, cultural differences. If I belong to a certain cultural group and I want to find a provider who specializes in that cultural group, I can use distance counseling to find a provider. In my case, anywhere in New York State, which is a big state, right? Or clinically, maybe I have a very unique clinical need and I want to find a provider who specializes in that need. There's a great study out there on, women veterans in rural communities who were victims of sexual trauma and had post-traumatic stress disorder. What a unique clinical group, and those women had an opportunity to collaborate with other women and a clinician via distance counseling. So we have great benefits from that, right? Also things like rural settings, those for whom have travel restrictions, either due to financial or physical or emotional reasons cannot travel. So we know that it gets us access to a lot of people and a lot of clients and a lot of students. However, despite those benefits, there are tremendous access limitations to technology. So really, not everyone has access to technology. They don't have access to devices necessarily. They don't have access to internet. They don't have access to bandwidth. I'm talking about broadband in a minute, but also skill. Like maybe they don't know how to do those things. And if you look at those disparities, they're often based on things like race, education, and income. So I'm just going to read you a few statistics regarding broadband, right? So if we look at broadband and broadband usage is present in 79% of white users' homes compared to 61% of Hispanic users' homes. Or broadband is present in 92% of households with an income over 75,000 compared to 56% of households with incomes less than 30,000. Broadband is present in 79% of households of college graduates and 46% of those that are less than a high school graduate. So again, if you have I'll talk about this under technology, the best, newest device software, and your clients need an iPhone 12 or whatever the newest one is to run it, it's not going to be very equitable. It's not going to be very accessible to them. So you really need to think about your client and student base. And that's why I say you need to assess your client and student context, because if your clients and students cannot connect, if they cannot stay connected, if they drop off constantly, they're going to become frustrated with the process and they're going to drop out, right? The other thing I want to stress too, and I think we saw a lot of this during COVID, a lot of us who teach at a college maybe paid attention to this. Clients and students have limited access to privacy and confidentiality. So a lot of people don't live in an environment where they can have a phone conversation or a video chat without someone listening in. So maybe in those cases, we're looking at things like text or email, or maybe we're looking at the fact that distance counseling isn't the best modality for this person. If you live in a shared living facility, like a group home, you're not necessarily going to find a private confidential space if you live in a shared living community. So one of the things the counselor is responsible for is assessing your client and student context. Okay, we could spend our whole time talking about technology, but let's just talk about some of the broad brushstrokes here, and then again, more of the details I have in the book for you if you're interested. So my takeaway with technology is just that it's constantly evolving, changing, and updating. And again, the responsibility is on you as the counselor to stay on top of those evolutions, changes, and updates. The thing we talk about most often in telemental health is safety, security, and encryption. So if you're not familiar, encryption is a term that basically is about scrambling data. So if somebody comes into your system, the data would be scrambled and unreadable. If something comes out of it, it would be scrambled and unreadable, ideally. And so we think about encryption, and we need to think about that as well as password protection. So beyond password protections, is the data encrypted? All right, is the software encrypted? Right. So people will say, yeah, I have a couple firewalls up, and so that's going to encrypt my data that comes in and out of my computer. But what about a third-party provider, right? So what about I'm using a VC, or I'm using a WebEx, or I'm using DoxyMe, right? Do I know the encryption properties of those third-party providers? If I'm using a separate software system to file my notes, or a separate email system to send my documentation to the insurance company, are those systems encrypted? So, we talk a lot, and you've probably heard this term before, what's called a business associate agreement. And the book talks about, getting a BAA, a business associate agreement. Now, the BAA is not going to necessarily protect you from liability, but it is a way in which you can sort of demonstrate that you've tried to follow best practices. And in the business associate agreement, that third-party provider would outline for you how the software or how the tool is encrypted. You also have to think about other technologies. So things like, phones and laptops. If my computer's all set up, but my laptop is not, my cell phone is not, how is that really going to work? Basically, when we talk about that, think about all your devices, not just your laptop. And also think about updates. When a provider sends an update, That's a patch usually because they've found a flaw in the system. So every time you don't run an update, you're leaving a hole kind of in your technology. Also, you can't really have a lot of control over this, but your client's technology, you might want to put something in your informed consent about their expectations for maintained devices or using secure devices or using password protections, right? And also finally, voice assisted technologies, things like Alexa and Siri and Google Assist. You would want to include in your informed consent something that's saying, that the expectation that those devices would be turned off. On your end, they should be turned off, but you kind of want to state that expectation on the client's end as well. All right, we're kind of winding down anyway. We're getting to our last slide here, and then just a couple of comments before we open it up for questions. So, um, the last thing I want to say too is that let's talk a little bit about funding and reimbursement. And I think every time we talk about funding and reimbursement, people who don't accept insurance go, "Oh, not for me. I'm not listening." It doesn't apply to me, and I understand that. I appreciate that. It certainly has the most bearing for people who are accepting insurance. But even if you're not, you might want to pay attention to funding and reimbursement. It's going to vary by your context and by your practice. So clearly, if you're using insurance, that would be something that you want to pay attention to. So are there any certain insurance requirements that are required for you to deliver telemental health services? So do they want you to have a certain designation, or do they want you to have certain, licensure requirements met? So you want to pay attention to that and see if the insurance has any certain requirements for you. But also, regarding reimbursement. So a lot of my colleagues who do take private insurance have told me, there's different CPT codes for telemental health. I think what you're going to find if you do take insurance, is that in the wake of COVID, a lot of insurance companies sort of lifted up their restrictions. However, what's yet to be seen is post COVID, how long those restrictions will stay. That being said, even if you don't take insurance, but your clients um, often reimburse or submit for reimbursement from their own insurance providers, you might want to let them know, you would want to let them know that they need to check for any limitations or any concerns about telemental health. And if they started with you under COVID, when these telemental health restrictions were open and available, and then suddenly insurance companies start to clamp down on those again, which I don't necessarily foresee happening, but it could. Again, you would want your clients to be aware of the fact that they should be checking on those things to make sure that they're still being reimbursed for telemental health services. And if you are a provider through an agency, so I'll use myself. Like I said, I do right now some voc rehab work for an agency, and we use state funds that are provided by the state voc rehab agency. While we transitioned pretty seamlessly to telemental health, some of us were already doing it before telemental health, which helped, before COVID, which helped. We did have to confirm with the state VR that they're still going to be paying for voc rehab services that are delivered via distance services. So, whether you're funded by the state mental health or the state substance abuse facility or the state OPWDD, as we call it in New York, you need to pay attention that those agencies are still willing to fund and reimburse for services provided via telemental health. And again, what you'll find is that post-COVID, a lot of them approved everything, but we have to wait and see what's going to happen going forward. Uh, while it's not directly tied to reimbursement, I do want to mention malpractice insurance and the importance of checking with your malpractice insurance to make sure there's no additional issues with delivering services via telemental health. And finally, just the whole concept of, counselor competence, making sure you're competent. You don't want to have, or licensure requirements, you don't want to have reimbursement sent back to you because you've missed something from a competence licensure or from a documentation standpoint. So again, if you're submitting documentation, do you have all the documentation you need for telemental health delivery? Making sure any forms you send, of course, are HIPAA and EPHI compliant, where that's all protected. So those are just some things to keep in mind, regardless of the setting you practice in. We're just about winding down. There's a lot of things I didn't have time to talk about today, but I do want you to think about them if you're thinking about telemental health and distance counseling. The first is counselor self-care. There's a nice part in the book where I invite clinicians who are doing telemental health talk about their experiences. We call it the voices from the field. And I think what you'll hear in these voices from the field from so many clinicians is that the lines start to blur, right? So my home is now my work. And when I commuted, I could only see 7 clients a week. But now that I'm home, I can see 10. So the whole concept of counselor self-care is really important in telemental health, that you really pay attention to those boundaries and those limits that you set for yourself. We didn't spend time talking today about mobile apps and ICBT, but that's really growing at a pretty quick rate. And there are ways in which those technologies are being integrated into individual counseling, whether it be face-to-face or distance counseling. Same thing with certain interventions or specific groups. We didn't talk about, for example, group counseling. So how do you facilitate an online group? I talk about this more in the book, but there's different, guidelines to facilitating online group dialogue as opposed to face-to-face group dialogue. Certain populations, this is another thing that comes out very nicely in the voice from the field. Children, I don't work with children. I tell it to my students all the time. I work with high schoolers, but not children. But some of the clinicians in the book who talk about working with children, and since they've transitioned to telemental health, what a challenge that's become. Involvement of parents, things like that. So those are some things to consider as well. If you're thinking about starting a practice, some folks like to start with like a BetterHelp or a Talkspace, but there's also a really nice checklist in the back of the book that kind of just walks you through, 50 plus things you should be considering if you're thinking about starting your own practice. I talk a lot when I present at conferences about training and certification and supervision, and also ongoing training. So again, I was first certified in distance counseling probably back in 2016. I transitioned to the board certified telemental health provider in 2018. But if I had never done additional training beyond that, I'd already be out of date, right? From just 2018 to 2020, I'd already be behind the times. So we have to keep ourselves current and keep our training fresh and that we're up to date with things. So I guess as I wrap it up here before we take some questions, I want to say that, distance counseling will continue to grow. Telemental health is really here to stay, but it continues to change. So you cannot be trained once, you have to stay current or else you'll become stagnant. There's a lot of evidence to support its use, but there are pros and cons. And so I believe that if you want to practice ethically and effectively, it's going to depend on counselors being prepared, counselors being competent, and of course, counselors being responsible. So with that, I'm going to turn things over to Rhonda to talk about the book, and then we'll take some questions.
Thanks so much, Heather. That was great. We did get some questions. I just want to repeat, because I think some folks didn't join at the very start of the presentation, that this event is being recorded. All of you have been muted the entire time, and we are taking your questions. We will be posing those questions to you now. This event is being recorded, and it will be emailed to you in about 7 business days, along with Dr. Robertson's presentation. And for those of you that have been asking, this is the cover of the book. The name of the book is Telemental Health and Distance Counseling, A Counselor's Guide to Decisions, Resources, and Practice. If you're interested in the book, you can click on the link or type in the link that you see right there, springerpub.com/telemental-health. If you're interested in the book and purchasing the book, we are now offering a 25% discount plus free shipping in the United States, as you see here, and that's the code. Lee, I think we're up to questions.
Hi, this is Lee Montville from the sales team over at Springer, and thank you all for, well, first, thank you, Heather, for an amazing presentation, and thank you all attendees for all your questions. So Heather, I'm going to go through a couple questions, and
Sure.
Any insights and information you can provide would be amazing. So the first question is from an anonymous attendee. Because of the pandemic, I got 2 new clients who don't live near me. If we have to return to face-to-face, they would not continue in therapy. Do you think that when we get to the quote unquote new normal, insurance companies will continue to pay for telehealth sessions? Is there advocacy for that going on?
That's a great question. I really want to say, because, this is what I want to say. I think that, telemental health has also been benefiting insurance companies. Let's be honest. We've been providing access to a greater number of clients than we ever have before. So I think if we're being fully honest, the insurance companies also benefit from us providing services. Regarding the advocacy question, I don't know, but I'm making my own notes to go and write it down. What I'm going to say, what my best guess would be, is that that's going to vary on a state-to-state basis. So again, if your state agencies, if your state organizations are advocating for continued coverage, then I'm thinking we're going to see that pressure put on the insurance companies. But I can't say how the new normal is going to look. There's not necessarily any major reason why they would pull back, except that maybe if they don't want to spend those monies, they don't want to spend those fees. But I do think that COVID, for counseling as well as a lot of professions, is just going to change the way we do practice.
Great, thanks so much. The next question is from Herman. If you have minorities to whom you counseled face-to-face before COVID, how do you close the gap created by COVID if they don't have access to telemental health?
Ooh, that's such a great question, and you guys are asking great questions. And the challenge is if the client cannot engage in telemental health, obviously we can't force them to do so. So my question to you is, are there ways that people can still safely provide face-to-face services? Some people are doing that as long as distance is not an issue. Like the first question was, distance was an issue. But if distance is not an issue, and you want to maintain those relationships and you want to maintain those connections, um, looking at ways in which they can safely get face-to-face services. I also want to say, there are community supports out there. So while we didn't talk too much about things like apps and websites and things like that, and there are some cautions in the book about that as well, but you also might want to just point those clients to some support services until we can get back to a face-to-face delivery of services. It's a great question. If there's a way, counselors have been being so creative. I had clients that created outdoor heated venues where they see their clients 6 feet across the room, and I've had clients who are meeting with their counselors in the waiting room instead of in the office because it's far apart. So if there's ways to do that safely and the client and the counselor's open to it, you could try that. But at the same time, if not, the best way would be to connect them to some support services, or even see if they'd be open to a phone session, which again, once you have a good informed consent, you could still do effectively once you point out the nuances of phone therapy.
Great. Stephen asked, what is your view of best practices related to client identification, location verification at the beginning of video conference sessions?
Before you
Alan?
answer, I'm sorry to cut you off, Lee.
Yeah.
Could you go back one slide, Heather, so people
Sure.
can see the book title and the
Yes.
information? We're getting questions about that. Can
I
they see it
apologize. Yep.
again?
Let me see if I can get back. I think, oh, there we go. Is that better?
Perfect.
Okay.
Thank you. Thank you,
Sure.
Rhonda. So Stephen asked Heather, what is your view of best practices related to client identification, location verification at the beginning of video conference sessions?
Yeah.
How important is it to have identification verification for people we are working with for extended periods and who we quote unquote know are in our respective state, et cetera? I've heard some have clients hold up driver's licenses before sessions, but I wonder if this would be considered necessary for subsequent sessions.
And I just so you know, Lee, I can see the questions as well. So I appreciate you that question as well, Stephen. I think you're
Great.
exactly on the money about what you're saying, Stephen. Generally, best practice is if I've never met you before, I need some sort of state-issued photo ID in that first session, so I can see, that the person that's sitting across from me is the person that I'm talking to. But subsequently, once you know them, is that necessary every time? Probably not. Especially once you feel confident the person sitting across from you is who they say they are. What I'm more concerned about, honestly, Stephen, is that whole sort of panning the room with your camera, make sure that person is in a confidential space, and you doing the same courtesy of panning the room with your camera so they can see that there's no one else here, there's no one else listening in. When it comes to things like email and chat and phone, we recommend things like a code word. The client selects a code word that's used at the beginning of every session. And so in those cases, we do recommend that code word be used at the beginning of every session and changed, because who knows if someone else has picked up that phone or sat behind that keyboard. Maybe not the phone if you're doing a telephone session, but certainly for a chat or a text session, we recommend some sort of code word that we can use to make sure it's that person. But that's a great question.
That's great. Lisa asks, are there recommendations on where to get telemental health counseling trainings or where we can get certified in New York State?
So there are not a lot of them out there, but there are a lot of them out there, and probably more that are growing. There's not a lot of certification. So the one standard certification is the board certified telemental health provider. It's facilitated by CCE, which is the Counseling and Education Group. But there are others, Zurich Training Institute, the Telehealth Institute. Just because someone mentioned New York State, I'm going to throw this out there. New York State doesn't require a particular certification yet, as far as we know. Who knows if that's going to change? But what I will say is that, because I am in New York State and I know this, New York State is very particular about where you get your continuing education credits from. So don't misquote me on this, but I want to say the Zur Institute is approved to give you continuing education through New York State. And I think I might also say that the Telehealth Institute is. So again, you might want to look at where you can get CEs in New York State to maintain your counseling license. Because right now, Lisa, until the powers above say this is the one certification you must have, we don't have that. So I would say get training that is obviously detailed and helpful for you, and then also if it helps. In my mind, it's an added bonus if I can use it towards my licensure continuing education.
Kimberly asks, what is the concern with voice-assisted technologies?
Yeah, great question. Just that the session would be recorded, just that it would be recorded inadvertently and that someone wouldn't be aware of that. So if you read the book, there's actually a lot of criticism of how things like Siri and Alexa and Google Assist listen and record those things. And so just the expectation would be that it'd be off. You can put your phone in like airplane mode or things like that to turn those things off. So we just wouldn't want a conversation being inadvertently recorded without the client's knowledge or without the counselor's knowledge. Now, you might be a counseling student, not you personally, but someone might be a counseling student, and there's an expectation of the session being recorded. That's something, of course, you would work out in advance with an informed consent document and an approval. But that's just the main concern, that they would be recorded inadvertently without you or the client knowing.
Great. Somebody else asked, is it possible to provide family therapy via telehealth if the family members reside in different states?
Yes. Hope you didn't hear me like breathe deeply when I read that question. So that's actually, again, a great question, but it's a little bit complex. And so here's what I'm going to say is that you need to look at who, like the way family therapy is designed, who is your primary client, right? Who's the person that's being billed as the primary client? And then again, you would look at the licensure laws or the guidelines in each of those states where people are located. Look at your own state and then take a look at where those people are located. And what I want to say too is don't feel like you have to get lost in the abyss of what's online. I have more than once called up the New York State Office of Professions and kind of asked a question like, is this in my scope of practice? How could this work, right? So you don't have to necessarily, I mean, you can look online, I would start there. But for the most part, if you're really stumped, simply call up. And then, of course, document everything you do, because what you want to do, going back to, the Health and Human Services law and going back to the good intent law, most counselors are operating with good intent. No one's looking to do harm, correct? So as long as you look for these things, you look that you're not violating any codes. There's a great app, Epstein-Becker-Green law, that kind of breaks down the laws by states for different professions, not just counseling, but social work, psychiatry, nurse practitioners. And you can look for those things, and then you can say, I've done my best due diligence. I don't find anything. I called my office and asked. You document all that. Should heaven forbid there be a situation, you can demonstrate how you followed your due diligence. And this is, again, friends, where your malpractice insurance comes into play. Make sure you're covered to deliver distance services.
Great. Nicole asks, how are providers providing telemental health services to individuals who identify as part of the disabled community?
Yeah.
Specifically, is there a way that closed captioning software can be used in a HIPAA secure manner that maintains client confidentiality?
That's a wonderful question. And again, that's my population, Nicole. And so, we're not working with I'm currently not working with clients who need closed captioning services. But I would say that's something for you to work out with those third-party providers that you might use. So what platform are you going to use? Are you going to use, Zoom or DoxyMe and I would connect with them about, is there a closed captioning option for those providers? There's actually an interesting study too that clients, interesting study, I cited in the book, that members of the deaf community might not prefer closed captioning. They might prefer to sign or to communicate via ASL with a counselor. So look at the data on that as well. But I would connect personally with that, whatever your third-party providers, whatever agency you're using for those services, and see if there's a closed captioning option. A lot of us has been on webinars where there's closed captioning. Sometimes those built-in tools are not so good. I'll be honest with you, they don't do the best job, but see what they can offer you in that regard. I can almost guarantee you it's going to be a fee for that service, but you want to explore that on that end. It's a great question.
That's great. We have a couple more questions. Charlotte asked, if there are others in the room with the clients and they say it's okay, how would you handle that?
Me personally, I would go back to my informed consent, because in my informed consent, I do talk about a confidential space where others cannot hear you. Others cannot hear you. Others cannot hear or see you. So I would kind of go back to that and kind of say, this is what you agreed on when we met. I've also had clients like take their session in their car, right? Is that possible? And you'll have a client that says, hey, I have headsets, no one can read. That's kind of a judgment call. I don't mean to be vague with you on that. But it's kind of a judgment call for you, where if you want to except that I personally don't. I usually I certainly had clients who say they were in a confidential space and then someone walks past them behind the screen. I was like, oh, is someone there with you right now? Yeah, and I would say that you really define, is there a place you can go that's private? And then that person will get up and move to their bedroom or what have you, because that's in my documents. I do expect them to be in a private space. And that's a little bit of a judgment call for you. But for me personally, because I've set the boundaries in my informed consent document, I maintain those boundaries. And you can tell sometimes too, like when the client, if it's video, they're looking around, they're looking at someone else, you can sort of tell. I want to take another question, Randy, but someone above, sorry, not Randy, Lee, I'm sorry. Someone above you asked about the Zur Institute. They said, how do you spell it? It's just simply Z-U-R. And so they're close. They have Z-U-R-E, but someone said Z-U-R.
Perfect, thanks. Lynn asked, you just mentioned about videos, and Lynn just asked, she's seen that Zoom is not HIPAA compliant. Is there a platform that you would recommend getting started in? So post-COVID, one wouldn't have to change platform.
It's a great question. So it's funny, Lynn, I intentionally stayed away from naming platforms in the book because of this whole changing kind of moving target. Now, I've been told that with Zoom, sometimes there are different levels of membership you can join that might generate different levels of encryption. So I wouldn't, you can check into that. What I see a lot of folks using, the doxy.me, doxy.me, and I see a lot of folks using the VC, VESEE. But if I'm being fully honest, Lynn, I haven't read the BAAs on those myself, so I don't want to guarantee that they are HIPAA compliant. But those are services that were used a lot by the medical profession prior to the COVID-19 sort of explosion. And so those are ones I would start with. But you can look at the different requirements for Zoom. And again, go back to the business associate agreement. Ask those questions about, hey, what's your compliance level? And then also, how are you going to maintain that compliance post-COVID? What I'm hearing, again, is a lot of the free sites are just not, they're not compliant. But again, you want to take a look at those and ask for those BAAs.
Great. There are a couple questions about students. So Tammy asks, what graduate class are you seeing this information embedded in most often? And Christine is asking, are you aware of any restrictions for students, interns providing telemental health services?
Sure. So Tammy, for me in all my classes, but that's a personal preference. And that's something I talk about in the book where, there really are no guidelines yet on where it should be. I think that personally, before COVID, I used to kind of throw distance counseling into my skills class and into my ethics class, right? I would kind of throw it in there and then we'd talk about it again later. But now what we're finding, and the way the book is designed, to be honest with you, is to talk about distance counseling and telemental health in every counseling class. So in skills, in group, in career, in research, and multicultural, right? So I believe it should really be infused a little bit in all of our classes. I think if you're talking to a faculty member where they're teaching it most, actually this is in one of the surveys I did in 2018, most of them are teaching telemental health in skills, in helping relationships, and also in internship. So that goes back to the question on internships. You really have to check your state laws. So as you all know, your state Department of Education approves your master's degrees or approves your education program. So every college has to be approved by their state to offer that degree, at least if they're accredited. So we had to, in New York, go up to New York State DOE and say, hey, what can we do? We had an interesting scenario where school counselors had more flexibility than mental health counselors when it came to interns. So in New York, yes, they approved us for telemental health. They originally did not approve distance supervision, and that was a big confusing issue, but that changed. And then they gave more flexibility to school counselors. They said school counselors could use like role plays and mock sessions, and they told us mental health counselors could not. So I know I'm dancing around your question. You've got to look at what state you're in and what the state Department of Education says about delivering services for graduate students in internship.
So just to add to that, we had another question just about how quickly informed consent documents are being updated for evolving. So that's similar, correct?
Yeah, I mean, here's the deal. The informed consent is really a practitioner document. It really is, it's a provider document. So you as a practitioner decide what's in your informed consent. So, if you were seeing a counselor face-to-face before COVID, and now you're seeing them telemental health, they may or may not have updated their informed consent. That's on them, and that's their responsibility. The risk of not updating it, if you transition to telemental health, is that should you have a condition that wasn't outlined in your informed consent, you wouldn't necessarily have a leg to stand on for that because it hasn't been discussed in your informed consent document. So that's what I would say is that really the updating the informed consent is really on the practitioner. That's on you. And, you know, no one's saying you have to, but if you don't, you're really opening yourself up for things like emergency planning, things like what do you do when the connection disconnects, right? And someone's in crisis. You know, those are some of the things we talk about in the case studies. I give you some case studies that are sort of worst case scenarios, right? What would you do here? What would you do there?
One other question we got was, are there contributors from different specialities in your book? So the voices from the field.
Sure, sure, yeah. So that's probably one. Even though I wrote the book, it's the stuff other people wrote that really I enjoy reading the most. So the book is broken down obviously by individual group counseling. We have providers who talk about multicultural counseling, career counseling, talk about rehab counseling, school, mental health, substance use, families and children. So yeah, there are specializations that we have providers from every field that come in and talk about how they're using distance services now. And what's neat about that is that some of them were delivering them pre-COVID and post-COVID. Some just made the transition. Oh, there's also some from graduate student interns who were forced to change midway as a graduate student. So those are also some really interesting parts that I enjoy because they're really just lived experiences.
So Heather, I think the remaining questions had to do with providing links to these resources. Would you say that they are included in the book?
They are. They're all in the book. Yep. But again, I just say folks can find me on LinkedIn too if they have questions. I'm on LinkedIn as well. But you can find me on LinkedIn and message me questions also. But yes, they are all there. There's so many more that I could have given you, but they're in the books. The question about training, I compare 3 training programs side by side. You can really someone has the link up there for the BCTMH. That's one of the programs I compare. Someone asked about the app, the Epstein-Becker-Green app. That's all outlined for you in the book.
Thank you. Okay.
Yeah.
Well, we're going to be wrapping things up today. I want to thank Heather for the great presentation. I want to thank Lee and Gina and all of the folks here internally at Springer Publishing for putting this together. And I do want to remind you all that 25% plus free shipping in the United States is available to you to buy the book using the code Robertson25 at springer.pub.com today. And if you are interested in adopting and requiring this book for a class of yours, if you're a professor and you're on this call, you can find your sales rep using that link as well. So thank you very much, everyone, for sharing some of your time today. We know how busy it is right now in January. And Heather, thank you so much again.
Thank you all for being here.
Have a great day, everyone.
Thank you. Bye-bye.